let me ask you this. Let me ask you the question this way. Do you think that Obamacare should be left alone? That you think that it's working for people in this country? The small business owners who say that
a lot of people.
Go ahead.
I think it is absolutely working for a lot of people who never had the financial security that they could go to the doctor, get the treatment they needed, make sure they had the preventive care they need. No question we need to continue to work on prices. That's important, and again, that's regulated at the state level, not by the federal government. These are private insurance companies selling private insurance. But Dagan, in the years before the Affordable Care Act, before 2010, this is a market where year in and year out there were double-digit increases. No question there was a jump in price this year. For most of the people participating in this marketplace, they also get a premium tax credit. So their premiums are not based on exactly what the premium is in the market. They're based on what their family income is, how affordable this is.
Secretary,
and this is affordable coverage for millions of people.
But you talk about this, I'm sitting here listening to you as if it's working for people and they're happy with it. The Democrats lost the Senate a little more than 2 years ago, largely because this law, because Obamacare isn't working. The Democrats lost in the last election because of this. You created a law where it encourages small businesses to have part-time employees because of the mandate. You have small businesses repeatedly have said that health care and health care costs are their #1 concern and the biggest thing getting in the way of them hiring.
Health care costs have always been their #1 concern.
Well, then you didn't take care of it because it's still their #1 concern.
There is no evidence. Again, I know we live in sort of a fact-free environment.
No, I presented you with facts.
Every economist says that we do not have employers moving workers to part-time. We have had year in and year out job growth as this plan has been in place. There hasn't been a drop in the market. Employers have not shed their employer-based coverage as was suggested. It has not been a job killer. 20 million people now have coverage. We have the lowest uninsured rates ever in the history of the United States, and overall health costs are rising at the slowest rate we've ever seen in the country.
In fact, health spending has started ticking back up.
I know that the facts don't back up what has been always the accusation. This won't work, it will kill jobs, nobody will get coverage, it will not provide care. None of that is accurate. There are now 20 million people with affordable health care. We'd like to have more competition. Should there be more price regulation? You bet. Should the Congress do something about drug pricing, which is by far the fastest growth? You bet.
So you think that the solution,
eliminate coverage?
You think the solution is in price regulation and price controls, and the solution is more federal government in your mind, greater federal government overreach?
Prices aren't regulated at the federal level, Dagan. They're regulated at the state level. I think state insurance commissioners, and I used to be one, should step up and do their jobs. And in the states where they have been aggressively monitoring price increases, you see a much lower rate. The most effective price regulation is more competition, and I think there are ways to encourage more companies to do business in some of the markets. As you say, about 20% of the markets don't have enough competition. We need to do encouraging of more markets, but to eliminate coverage without any replacement plan, except, I must say, the Republican plan for high-risk pools. High-risk pools are not insurance. It's putting all the sick people in a pot. Again, many states like Kansas used to run high-risk pools. Wildly expensive and not effective.
So you don't like what has been proposed so far by the Republicans?
Well, the high-risk pools are not insurance coverage. They need to be honest with the American public. That's one element to it, but there is a multi-pronged plan that we've heard about from the Republicans. We'll talk about it in the next hour. Well, I haven't seen the multi-pronged plan to replace coverage.
Well, I can go through it. To drive down costs, you have transparency in the pricing. You expand access to health savings accounts. You replace the subsidy with a refundable tax credit.
Health savings accounts are not insurance coverage.
But again, it's self-directed health care in terms of the individual decision versus the government. I want to pose this before we go. Given what the Republicans are planning to do, would you rather see single payer for the nation, say Medicare for all? Would that be better in your mind than what the Republicans, in terms of more power to the individual, what the Republicans will likely put in place instead of Obamacare?
Well, more power to the individuals means nothing if you can't afford coverage. So I think the notion that somehow the Republicans will have keep the insurance companies selling to people with pre-existing condition without any financial help and any support is meaningless. Because people will not be able to afford the coverage. So I'd like to see what is in place. I'm not advocating a single-payer plan. I believe in the plan that had the private market moving into individual coverage and offering full coverage, particularly to people who had pre-existing conditions and who couldn't afford their employer coverage. That's what we have in place. I need to see a replacement.
Secretary Sebelius, and Donald Trump wants to keep that pre-existing condition element as part of whatever is replaced. So, Secretary, thank you so much. Good to see you. Thank you. Take care. See you soon. Nice.